I'll do that. Good afternoon, everybody. Good morning, good evening, depending on where you are in the world. The whole world has finally become a small global village as we live in the COVID-19 days. The coronavirus has changed the face of the planet forever. Welcome to our podcast this afternoon, Coronavirus, the business continuity during and after coronavirus. My name is Kilian Songwe. I am the president of a Global Healthcare Public Foundation. I'm actually streaming to you from our office in Kampala, Uganda, and I'm very happy to be able to join you. I welcome you to this podcast this afternoon, and basically just to have a quick conversation with you about some of the things that we're going to be discussing today. I'll take you through this. So, business continuity during and after the coronavirus, COVID-19. Again, as I said, my name is Kilian Songwe. I am the president with a Global Healthcare Public Foundation. I have had over 25 years of experience in process transformation, extensive consultancy experience. The foundation has been around for almost 18 plus years, certified organization. We do business in over 14 countries. And we've taken a number of institutions to certification, well over 84 of them. So for today, I want to actually take you through two very simple standards. And they're very important for managing systems. The first one is the ISO 9001. ISO 9001 is a quality systems standard. And then there is ISO 22301, which is a business continuity management system standard. And it is very important for us to look at these two standards together, because from the quality systems point, there are some important things that we want to look at during the COVID period. We want to look at what are the risks that have been determined in our institutions. We want to see what our priorities are. How are we going to do business during this period? There is a change in workplace. How do we manage the change in workplace? And the basic infrastructures and communications that we're going to need during this period. And in 22301, we're looking at how do we continue our business. And there are two places to continue business from. The first place would be you're either going to be continuing business during the COVID period, or you're going to be reopening your business post-COVID. In either of those places where you may find yourself, you have to have a business continuity management document in place. So why business continuity management? These are very important things we're going to look at during this presentation. The return on investment in coming up with a proper business continuity management system. Why should it be put in place? How it forms and how it works as well. But then we also need to look at what are the other collaborative and institutional regulations and standards that we need to be aware of. And also very important, if you're going to do business continuity, we want to think about top management. What is top management support? And then we'll come to a conclusion. So my dear friends, welcome. When we look at standard, there is something which we call the high-level structures to standards. High-level structures to standards, when you look at, for example, ISO 9001 and ISO 22301, I have looked at the clause 4 through clause 10. I left out clause 1, 2, and 3, which is very standard in all the ISO documents. Clause 1 normally talks about the scope, what are the boundaries of your work. Clause 2 talks about the normative references, what are the obligatory documents that you have to take into consideration when you're implementing the standard. And clause 3 talks about terms and definitions relevant to the ISO standard that you're using. But now, in terms of ISO 9001 and ISO 22301, from clause 4 to clause 10, they're exactly the same. It says context. It says leadership. It says planning. It talks about support. And then it talks about operations, performance evaluations, and then improvement. I also want to take the advantage at this point as I make this presentation. I'm talking about the high-level structure of standards, and then bring to your attention the whole PDCA cycle. The plan, do, check cycle is a very instrumental cycle in trying to develop management progress. And when you look at these two standards, the context, leadership, planning, and support falls under the plan part of the PDCA. The operations is what actually gets done. That's where you do things. Performance evaluation, That's the checkpoint. You actually evaluate your systems. And this is where another standard comes in, the ISO 19011, which is a guide for doing audits of management systems. And then you do improvements, which basically means you've looked at your system and you're going to adjust to continue to be sufficient and to be suitable for the system that you have. So under 9001, one of the first things that you're going to look at as you plan for your business continuity is you're going to do a risk assessment. And so what's in a risk assessment? Thinking about a risk assessment, there are actually two very important things that I want to bring to your attention at this time. There are threats on the one hand, and then there are vulnerabilities on the other hand. And I just put up three threats here, which I am personally familiar with. I put up floods. There was the big Katrina floods in the United States that lavished the whole of New Orleans. Then there is the pandemics, which we are living in today, and then the cyber attacks. And then when you look at on the vulnerability part, you're thinking about what happens to infrastructures. You're thinking about what happens to service. What are the things that are going to be vulnerable to these threats? What happens to machines? One of the big things we learned during the floods, the Katrina floods, was a lot of people thought that the best place to keep your servers was in the basements of buildings because it was cool. But now when we had the floods, what was the first thing that got destroyed? It were all the servers. So today we now know the vulnerability of having servers in the basements of our buildings when there is a potential of a flood. So when we look at our risk analysis, our risk assessment, the three very important entry steps. First of all, we're going to do an identification of what are the risks in our systems, what are the risks in our organization. Then we analyze them. An analysis basically comes up with a very simple metrics. What is the likelihood that is going to happen? What is the consequence if it happens? And then we have an impact. That impact is called the evaluation. Now, when you do the evaluation, you're going to be able to say that based on the likelihood and the consequence, the risk is acceptable, which means it is very small. What are the chances that the roof of my office building is going to fly off? The chances are very small, so that's an acceptable risk. Now, what are the chances that because of the voltage and power issues, my electrical systems might be blown off? And if they get blown off, what does that mean to my ability to communicate with the rest of the world? That's a risk that is totally unacceptable, which means I have to move into the next phase, which is a response phase. So what am I going to do to mitigate the risk of me not being able to access the rest of the world, or the rest of the world not being able to access me because of a power failure or damage to my electrical equipment? Now, continuing to think about what happens in a disaster, and in this particular case, we're thinking about COVID-19. Risk communication becomes very important. We need to communicate with the four very key people that I'm looking at here. There are suppliers to our organizations and our business. There is the operation that we run, which is centered to everything. Then there is logistics. Logistics basically on both sides. The suppliers have to get to us, and we have to be able to deliver a service or product to the rest of the people. Then, of course, there are the customers who will receive this service or product. So let's look at the suppliers. We need to always be able to understand what is the nature of our suppliers during a disaster. In the case of the coronavirus, we need to be able to see our suppliers still going to be there. Are they open for business? Have they been closed? What is their status? Then we go to our own operations. Our own operations have a couple of key components. We have the people that manage our operations. We have people who are going to work off-site. There is going to be telework. We have people who, in the case of the pandemic, are now working off-site, understand the chance of being infected. Or we have people who are vulnerable because they have other infections. They might have asthma. They might have some respiratory problems. So they are vulnerable, and we need to take that into consideration. Schools have been closed. The parks have also been closed. And we have employees who have children. So we need to take that into consideration. How are we going to manage the care of the children? Then, of course, internally, we have to manage the risk within the people who are in our space. We need to also think about personal protective gear that people in our space can use. I'm thinking about things like the sanitizers. I'm thinking about things like the mask. I'm thinking about washing of the hands and those kinds of things, cleaning of metallic surfaces and those kinds of things. But those are things we have to do internally. Then from our logistics point, there are couriers that we also need to be able to see. Are the couriers working? What is the status of the courier services that we're using? And do we need to have an alternative? And I'm thinking right now from a business perspective, in 2003, for those of you who are in the Americas, you will remember in 2003 when there was a major snow disaster. There were most of the people, most of the businesses had accounts with FedEx. But when FedEx couldn't move because of the snowstorm, people were trying to open accounts with DHL, and DHL bumped the prices. So this is the time when we have to start thinking, what are our alternatives? Who are they? And how do we engage them at a meaningful cost value proposition point? Then, of course, there are also going to be our customers. We really need to know in what state our customers are so that we know how to schedule the services or delivery of products to our customers. Then the key priority elements that you want to look at from a point of ISO 9001, which is the quality systems. You want to ensure safety. Ensuring safety is a very big thing. Washing the hands, sanitizers, protect the customers, social distancing, 2 words that have become very familiar today. What are the delivery dates? Who is going to be there to receive the goods? Reduce lead time, because our working systems have changed. Maybe our lead times now for delivery of service and our products have changed. And then, of course, there are going to be issues of reduced cost, either because we're not doing as much work, our work volume has ramped down, and so there is certainly a reduction in cost. In today's age, one of the biggest things that we have to look at is infrastructure and communication. Most of our staff are going to be working remotely. So what kind of hardware was the provision made for them to work from home? What kind of hardware, what kind of software do they have? Is it robust enough for them to do the work from home? Everybody is going to be trying to do some kind of cloud service. There's a whole standard on clouds, on information security. 27001 is the standard that covers information security. But then we need to be able to understand, what are we going to be getting? How much are we paying for? Do we need it? But those are things that we need to look at when we do the risk assessment at the very beginning. As a company, you need to do a risk assessment with the projections of how do you continue to do business as you grow. Then, of course, we have to train people. We have to train people on how to use Zoom. We have to train people on how to use Skype. We have to train people on how to get connected and the ethics of doing e-conferences. That's a training that actually needs to happen. We need to establish alignment calls because people are going to be working from different places. The structure also changes. So people are going to be reporting now to different sets of people who traditionally would not have been their reporting hierarchy. But those kinds of things have to be looked into as part of your infrastructure. New communication channels. What other modalities of communications are we going to use? And very important, we have to remove uncertainty. People working remotely are always going to not be sure about what happens next. And we need to be able to ensure that there is a line of communication that allows for people to be able to know what is the next action that is expected on my side. Include customers and suppliers. They are a key part of your business. Somebody needs to supply a product to you, which is an ingredient or a tool in the service or product that you're going to supply to your customer. So these all constitute your whole infrastructure and communication. Now, we move on to change in the workplace. Now we've come out of our traditional office buildings, and there are things that we need to look at. There are things we need to prioritize. We need to think about planned redundancies. We're going to have more people working from home doing different kinds of things. We need to think about people are no longer working at home. What kind of personal protective gear do they need? Clean and sanitize routinely. For the people who are in the space, we need to clean many times because there are customers who are coming into the space, we're sharing space with people we don't know. Promote social distancing, suspend visits and trips to other customers or people that we're supposed to do business with. Manage audits remotely is very important. We need to be sure that we can still continue to audit the progress and the work that we're in. So I just quickly wanted to look at planned redundancies again from another perspective. It is very important to think about planned redundancies because if you look at our case, for example, I use ourselves as a personal story. we have people working in shifts. So we have a group A and we have a group A and a group B, sorry. So we now need to think about, we determine what our critical functions are, and we ensure that there are competencies in both group A and in group B to ensure that our services continues without any disruption. So that's going to be a redundancy, because if you are under normal circumstances, you will have your competencies in the people in group A, and the people in group B would have different sets of competencies. But in a situation like this, you have to leverage those competencies. Determine the competency gap. Now that's important. That's very key. Now you know what your critical functions are. You know what the competencies are that are required. Now you know what the gap is. And the next thing is the action. You come up with trainings to be able to close that gap. Then you evaluate effectiveness of the work that people are doing remotely, and you have morning meetings. Depending on the size of your team, you could decide to have a meeting every morning at 8 o'clock for a few minutes. You could decide to have it every other day, so that you continue to remove the element of uncertainty. People feel like they're being engaged. You're not seeing them. They feel like you're not talking to them. You don't care about them. But you come up with morning meetings to evaluate the effectiveness of the work that is being done. But also you promote learning. Promoting learning is key. People are not going to be actively working for 24 hours while they're at home. This is an opportunity for them to develop other skills. So communication, we've spoken about communication a lot of times, but this is one of the very, very most fundamental elements in the ISO 9001, because we need to talk about what is going to be communicated. Now, during the pandemic, a lot of things have changed. So we have people working remotely, we have shifts, and we have those kinds of things. So there are new rules. I use procurement as an example, because you have two groups of people, the procurement channels are going to change. So there are new rules that you need to communicate that to your procurement team and your finance team. When to communicate? As soon as there is a change, that change needs to be communicated to all your staff, as well as all the people who become interested parties. To whom do you want to communicate? All associates. In our case, our staffs, we refer to our staffs as associates. So in this case, all staff, all interested parties need to be communicated to in a prompt and meaningful manner. How to communicate? There are so many ways of communicating, to include public announcements. If it means you have to go on the radio because there is no network for some of your people in certain places, then you have to go on the air and then do some public announcements. Who communicates? This is very important. This is very, very important. So depending on what has to be communicated, depending on the level of the communication, it could either come from top management, it could be from a regional office, it could be from the head of a department, depending on what needs to be communicated. So one of the other things, we're still talking about the ISO 9001. One of the key components of the work that you're going to do is your suppliers. And it doesn't matter whether they're supplying you a pen, or they're supplying you toner, or they're supplying you paper, or whatever it is they're supplying you, they are a key part of your business. So you want to understand, what is the state of your supplier? Did they close down? Are they still in business? What is their turnaround time? Can they still deliver to you as expected under normal conditions? What is your inventory level as you go into a pandemic? You want to be able to look out 6 months in advance ahead of you at the minimum, because you don't know how long it's going to last. You want to be able to have a long-term projection. So by the time you're down 50% of your long-term projection, you have a sense of, is this disaster going to last longer? Is this pandemic going to be around longer? Do we need to start talking to our suppliers? Do we need to look for new suppliers? What other suppliers are in the business? This is time when you have to leverage. You have to look for new suppliers, because what happens in a disaster, what happens in a pandemic like the one we are in, prices change, prices go up. So you want to be able to find out who are the other suppliers who are in your business and what are they doing, so that you can leverage pricing. Look at the list of pre-qualified suppliers. A very important thing. Who are the people on your pre-qualified list? You want to reach out to them. How are they doing? Can you now bring them in? Because maybe your primary supplier is running out of stock. So you want to look at the other people who have been pre-qualified and start talking to them to say, hey, I'm going to need you to deliver X. I'm going to need you to provide me with this kind of service. Something that people always tend to forget is to forget that the disaster is going to end. And if you remember that the disaster is going to end, you might not know the date, but you want to be thinking ahead, and you want to communicate to both your customers and your suppliers on such and such a date, we are going to go out of our disaster mode of operation, so that they know. Then what does that mean to them? It may be during a disaster period, everything was a rush delivery. But when you communicate to them and you say to them, on the 25th of May, we're going out of this mode of operation, then they know, come the 26th of May, there are going to be no rush deliveries. So that's very important to note. So now we've spoken about 9001, we've spoken about looking at the risk, we've spoken about communications, we looked at the priorities, we looked at how you walk out of home, we looked at our suppliers and the customers and how to engage them. So now this is all what happens during the disaster. But now what happens post the disaster? The government comes up and says, you know, the disaster is over, COVID, we've managed COVID, it's now at a reasonable spot. What happens after this? If you're thinking business continuity, you always have to have an incident response team. And an incident response team is a very important team because basically it constitutes not only of management, but of other key department heads. So those key department heads would be able to inform management of some of the important things that need to happen for services or products to continue to be delivered. You think about competent associates or competent staff, as your case may be, reliable communication. Those are things you need to be thinking about when you're talking about business continuity. How am I going to be able to communicate reliably with the rest of our staff? Competent associates, I put this here twice because remember when we looked at 9001, we spoke about redundancies and we spoke about competencies of staff. You have different groups of people working in different places and doing the same thing over and over again. We need to ensure that the competencies are the same. Checked once, checked twice, checked always will be the same. Then we need to test what we've put in place because this is about our business continuity. We need to be able to ensure that the policies, the procedures that we have in place would work when the disaster comes up. We need to evaluate that. So what is business continuity when you think about all these bullets that are around? It's very simply put, it's a holistic management process. And that holistic management process identifies threats. We spoke about the floods, we spoke about cyber attacks earlier on. It identifies threats to your organizations. And what is that impact to your business operations? So I put it right down here, it says it safeguards the interest of its key stakeholders, but most importantly, the reputation of the organization. The reputation of the organization, the brand, and the value that it creates is very important. So right here, this is a quick incident management process flow chart. Basically, there's the setup of the incident management team at the top, and then there's a feedback that goes, feedback and control, gets into the operation cycle, information gathering, what is going on in the community, what is going on in the business world, assessment of the situation, is how is the disaster, at what level is the disaster? Is the disaster peaking? Has it peaked? Is it beginning to decline? And then we make plans, decisions are made, and then the information continues to go around, and then decisions are taken, implementations of those decisions are made, and then the incident management team, which is mostly top management and some key department heads, they review those decisions, they support it, they provide resources, and then back again we go. So why business continuity management? Why? This is really, really important. Everybody opens a business and everybody starts a business for the long run. I don't know of anybody who opens a business or starts a business and say, you know what, my business is only going to be around for the next 36 months. We all open businesses and we start businesses because we are going to be there in infinity. So you need to have a business continuity plan. So what are you talking about in a business continuity plan? We're talking about protecting organization reputation. And we're talking about this both ways. It's upstream and it's downstream. There are people who are waiting for product and services, and there are people who are also going to supply you. And you need to be assured that your suppliers are going to be around for as long as you are going to be around. And you also need to be assured that the people requesting your services and products will always be there, and there will be a need for your services and products. So when you can ensure what happens downstream and you can ensure what happens upstream, then now you can be sure that you're going to have a true business continuity management system that keeps you around doing your business for as long as you want to. Then, of course, BCM can also be used for procurement qualifiers, contractual requirements. There are some governments, I know in the UK today, business continuity processes and policies is a big thing to be able to get government contracts. So business continuity and return on investment. It's very important, because if you don't have a business continuity policy in place, then you don't know how to recover. You shut down when there was a disaster and it's now time to reopen, and you bring in everybody at the same day, or you don't bring in everybody at all. You bring in a consultant to help you start up. So it's the business continuity program or policy. What that does for you, it allows you to be able to know how fast you can recover, how fast you can start business. And then, of course, it manages your cost. That's a very important thing, because now you know whether your customers are going to be there, you know how soon your customers are going to come back on board. And so now you're going to have to scale up depending on what is the status of your customers. Identification of ineffective and unnecessary risk controls. This is a perfect time. You are coming out of a disaster, you're coming out of the coronavirus pandemic period. This is time for you to go back and look at your risk analysis and the controls you put in place. How did they work? Were some of them redundant? Were some of them unnecessary? Perfect time to do a check on them. Catalyst for business processes improvement. Perfect. Another time for you to look at your business improvement and say, you know, it worked, it didn't work. These are the changes we need to make. Perfect time for evaluation. This is the time we're going to make changes to our business. This is the time we're going to bring in certain things, certain key tools to allow us to be ready for the next disaster. Then, of course, this is a really important one, insurance premiums and covers. If you don't have a good business continuity plan, yes, you go out to get insurance to be able to ensure that your business is around. The insurer is going to give you premiums that relate to the status of your actual reality. What do you have in place that shows that you're going to be able to weather a storm? So, following up and talking about business continuity, how to. This is the actual rubber meeting the tar. You have to define roles and responsibilities of the different people, the different branches, the different authorities. You have to have an activation process. At what point does the trigger come down and you know that now is the time for our business continuity plan to go into effect? How to manage immediate consequences? There are going to be fallouts. There are going to be fallouts. How do you manage them? How do you pick up and run? Communicate plans. Think about who are the key interested parties. Make sure that they understand your plans. How to continue to reopen priority activities. So you've gone through the disaster. You need to know, and we saw this in ISO 9001, what are your priorities in your business? How do you open the different priorities? Do you open them all on the same day? Do you stagger them? Or how do you go back into operations? And when do you actually say it's time for me to halt my business continuity plan? One of the biggest things in business continuity is resilience. Resilience. You're going to create cross-functional teams. And when we talk about cross-functional teams, we're also going to be looking into issues of competence, which we saw earlier on in 9001. We talk about what plans are in place. So do you have policies? Have you put some plans in place? Have you tested them? And now this is where the resilience actually comes in. What risk assessments have been done? And now, as a regular organization, you need to do some audits. You need to do some assessments of your business operations and find out what the risks are. But now, this is also another very important element. Your business operates in a total hemisphere with a lot of other elements that are included. And just for this conversation, I've listed a few. We already spoke about ISO 9001, quality systems. There is ISO 27001, information security, people who want to keep their data in the cloud. There is ISO 45001. We need to think about the health and safety of our staff during the pandemic. There is ISO 9011, which is auditing management systems, which is something we have to do. That's the only way we're going to be able to identify risk, and we're going to identify the suitability of our management systems. Then, of course, there is ISO 22301, which is the business continuity management system ISO. And most importantly, there is ISO 31000, which is risk management. Of course, risk management allows you, as we saw under ISO 9001, to be able to accept what is an acceptable risk and what is not an acceptable risk. Responsibilities of top management. Establish the policies and objectives. How are we going to ensure that we have a true business continuity plan that works? Ensure integration. We have to have cross integration between our different departments. We need to ensure that that happens. Very, very important. Resources are going to be required. Resources are going to be required. Communicate important. Communication is important. We need to make sure that people understand what needs to be communicated. Direct and support from top management is very important. They need to be able to know that there is a place where they can get proper direction and they have support from top management. And then, of course, promote continual improvement of the system. So at this point, I want to pause and I want to take the opportunity and give you our story. Because it's very easy to talk about ISO 9001 or talk about 22301, but let's talk about something real. I want to talk about our own story. So as we came into the COVID area, we looked at our workforce. We looked at 4 very important things, and I'm going to go through them right now. So we looked at our workforce and protection of our associates. What were the elements that we had to look at? Security of our people, how we're going to communicate with our people, how our facilities were going to be maintained. And then, of course, most importantly, because we're going to be working from all over the world, what our IT infrastructure was going to look like. Then the next thing that we had to look at was, of course, communication. How is this communication going to be done? Who is going to be communicating to who? And all the elements around communication that I spoke about. Then next is our customer engagement. We need to communicate with our customers. We need to look for incentive management. How are we going to incentivize our customers to be there and to be able to know that, oh, you know, we can continue to do work with the AGHPF? What is the security around us staying in business? Are our customers going to be there? Can we deliver services for them? Are we going to be safe when we try to deliver services to them? Prevention, interventions, trainings, very important things that need to be looked at. Then financial stress. Procurement. During disasters, some people want to be paid cash. There is no time to do bank transfers or wires or those kinds of things. So we need to look at the procurement structures that are in place. We need to look at our supply chain. How is it going to be affected? What is the logistics involved in our supply chain? And then liquidity. We want to be able to have hard cash on hand. Hard cash on hand is king during a disaster. With hard cash on hand, you have liquidity, you can actually make things happen because you pay in real time and service and deliveries actually get done. Financial analysis, you need to continue to analyze how your finances are going. This is a time when you're spending more money and you're spending money fast. And so financial analysis must be done and done regularly. And then inventory management, what do we have to be able to continue to deliver our services and products? Then, of course, coordinating all of this is the management team that is responsible for doing coordination, looking at the response. We tried out a number of scenarios, what if, and then what if, then what if, then. We tried a number of scenarios to see how are we going to actually implement our disaster plan and our recovery plan. We looked at a couple of portfolios actions. And this is some other really important things. We had to answer 3 very basic questions. When do we actually activate our business continuity plan in the case of the pandemic? And for us, we only had 2 very simple things to look at. And the 2 simple things we had to look at, number 1 was we said, as soon as we have 100 cases in the country, instantly, we're going to activate our business continuity plan. Or the alternative was if there was a presidential directive or a directive from the Ministry of Health, then we will certainly follow that directive. But if there was nothing, as soon as the country hits 100 cases of positive COVID patients, instantly that is our activation point. And when I say 48 hours, then our 2 teams will now go into a rotation of every 48 hours, would have a new team. How are we going to continue to stay in business? E-conferencing. So yes, the issues of Zoom, Skype, and all the other forms of communications come into place. And then we had to have some training around this. How do we continue to be relevant to government? How do we continue to work with WHO, the Ministry of Health, support the creating of SOPs for the disaster, in this case, the pandemic? Where do we benchmark against? That was the how do we actually manage ourselves during the pandemic. And then what are some of the key things that we had to be looking out for as we continue business during the pandemic? We need to look at what is our burn rate? How are we doing with cash? What is going on with our finance structures? Salaries. Our staff are still working. They're just not working from the office. How do we ensure that their salaries get to them in a meaningful time so that we don't disrupt their personal lives and then as a result disrupt our business? Support the Ministry of Health. We are a health organization, and so we look for ways of supporting the Ministry of Health. And then, of course, what's our community social responsibility? At this point, there are so many people, there's so many forms of new disasters. The homeless have increased, people are hungry. How do we engage in all of these things to ensure that during the pandemic, we're still useful to the community? And then I have this phrase down here. It says, pause to assess what is going on around you, anticipate what is going to happen, and then act. And I have a couple of slides here which are interesting. To your top left, that's the rest of our associates having a conference call. To your bottom left in the back, that's our board meeting. Right in front of you is one of our staff, Mohammed, using the sanitizers which are placed on all the walls in our facilities. And as you go to your right, we're able to work with the South African National Accreditation Services to carry out remote assessments for some of our medical diagnostic labs. This is the first time that it has ever happened where the South African National Accreditation Body has actually carried out a remote assessment. But this is because we were prepared. We were able to engage them to be able to do this. So we have a couple of slides that talk about different facilities that were assessed in this period. So going back to 9001, quality systems, and then bringing on 22301, business continuity, it allows you to see how to operate during the disaster, in this case, the coronavirus pandemic, and how do you open up business, or how do you continue to do business post the disaster or post the pandemic. And from a Global Healthcare Public Foundation, there are just 6 very quick things that we can do for you. The first one is you contact us and we get a standard for you. We conduct a gap analysis of your institution, see where you are, see how you're doing in terms of business continuity. We would provide trainings for you. We will provide implementation techniques. That's one of the things we're very good at. How do you implement a business continuity plan in your institution? Who should be involved? What are the resources that are required? How long is it going to take? What is it going to cost you? And we'll assist you with coming up with the policies and procedures depending on your business. The policies and the procedures would be different. Depending on the scope of work that you do, the policies and procedures would be different. And then for small businesses, I'm generally looking for businesses that are under 25 employees. We could help with fast track services for startups. Basically what happens is we just put together, this is going to be a turnkey process. We deliver to you a whole set of business continuity documents and training that allows you to be able to implement and get started. So that said, you certainly can reach either myself or a Global Healthcare Public Foundation at this contact. We look forward to talking to you very soon and help you in growing your business and ensuring that your business is around for as long as you want it to be. I would like to acknowledge McKinsey & Company, Tony Druitt, and Carlos Perez, and of course the associates at the Global Healthcare Public Foundation. Thank you very much, and I look forward to taking some questions. And I'll see you next week, same time, when we look at trying to demystify the big talk about antibodies and antigen testing in community surveillance. Thank you. I stop sharing.